Hi, good morning. Welcome to Association of Lifelong Learners at Alpena Community College. Today's presentation is by Ashley Rodriguez, who is going to talk to us about coping with seasonal affective disorder.
Okay, I turned mine back on. Okay, can everyone hear me okay? There we go. Okay, well, thank you for coming to the presentation for those who came in person and for those who are attending virtually. Like she said, my name is Ashley Rodriguez. I am a limited licensed social worker at MidMichigan Health Alpena. I work in the inpatient psychiatric unit, and I am, well, I'll go into a little bit more about who I am in just a moment, but this is my second time presenting before the Association of Lifelong Learners, and I appreciate being asked back. It's always fun to come do these. It's a nice break from my work day. Today, what we're going to be talking about is, like we said, seasonal affective disorder. I'm going to give a brief introduction, talk really about what seasonal affective disorder is, how it differs from any other version of depression, and then what you can do about it, because that's really the point of it all, right? Is how can we get through it? A little bit about me and who I am. Like I said, I am, oh, there's my picture. I forgot I put that on there. I graduated from Grand Valley State University here in Michigan a million years ago, back in 2007, with degrees in psychology and criminal justice. And then I went for a master's in forensic psychology. So I worked as a psychologist in the legal system. Forensic psychology is the intersection of mental health and the legal system. Good morning. And so I worked there for approximately 10 years in different settings before coming back for a master's in social work from Arizona State University. I graduated with my master's in social work as the pandemic really took hold in early 2020 and moved back to Michigan. I like to say I accidentally moved to Michigan because we came to visit my family on vacation, and then my children refused to get back in the car and go back to Baltimore. They're like, you can go back to the city if you want to, but we live with grandma now. We're staying here. So we decided to stay, and it's been great the last, almost 2 years now. So I have quite a bit of experience in mental health settings, different ones throughout the field. And like I said, I currently work in the inpatient psychiatric unit here at the local hospital. And so that's just sort of the basics and why I was asked specifically to speak on this topic. It's sort of my field. All right. So what is seasonal affective disorder? Has anyone first off heard that term before? More than one person. It's the colloquial term, it's the common term for what is actually in the mental health field just called major depressive disorder with seasonal pattern. Now, how that differs from other forms of depression may be more consistent, or they may have no known timeline. It could be triggered by just about anything, or it could have a specific trigger, a loss or a grief, trauma, something that sets that off. Seasonal affective disorder specifically, we can't find any of those other triggers or causes, but it does seem to be time linked, that the same time every year you start to experience an increase in these symptoms. So just like with people who have that winter blues you've heard of before, it's a similar effect of that, only it's usually more severe. It leads to them experiencing a higher rate of symptoms and higher rate of distress. There is actually a spring and summer onset of it. Most people don't know that. Most people think of seasonal affective disorder, they think of the gloomy winter months. But there is a whole section of people, although less common, that start to get an increase in depressive symptoms when the spring and summer comes back. Yes, I know it's somewhat surprising. People are like, why would you get sad when it's finally nice out? But it does happen. And so whichever version of it occurs, it's that cyclical, relapse of symptoms that occurs at a certain time schedule. Just like any other mental health condition, though, it should be properly diagnosed by a doctor. And I want to start out by saying, yes, it is serious enough that warrants going to your doctor. And at the same time, yes, it is serious enough that it should be treated by a professional. People will Google stuff, or they'll go on the Mayo Clinic website and they'll go, oh, I'll just treat my depression this way. That is definitely not recommended. And we will go into that when I'm going through the criteria. But it is a mental health condition like anything else. So I promise this is the slide that has the most words on it. Most of them won't be like this. The circle in the middle, you have the general symptoms. Most of these are the standard symptoms of depression. feeling sad or down most of the time, losing interest in things that used to be fun, trouble sleeping, changes to your energy level, changes to your appetite or your diet, trouble focusing, and then the hallmarks of depression, feeling that hopeless, worthless, or all the way down to wanting to harm yourself. Sometimes it's even not an intent to harm yourself, but just that if I didn't wake up tomorrow, that would be okay. It would be considered suicidal thoughts as well. Now, within the specific scope of seasonal affective disorder, there are the symptoms that are more commonly found in the different cycles. In winter, you're more likely to have the oversleeping. Basically, you're hibernating. You really are. You're taking extra naps. You're having trouble getting out of bed. You're going to bed earlier. You'll have people craving carbohydrates. And that one I know sounds weird, but it's true. Just like a bear or an animal that hibernates, you're packing on carbs and slowing your metabolism down. And that craving is there. It then therefore leads to weight gain. We're less active and it affects your energy level. You're more tired. The spring summer side, you have a little bit of the opposite. People have a hard time sleeping. They may not be hungry. That it's too hot to eat right now. Sounds like a weird sentence, but it happens. You'll therefore see weight loss. They may be more anxious, more irritable. Now, what we know about how this occurs. First off, it is linked in families. People in your family may have seasonal affective depression. You are more likely to have it. You also may have, a higher risk of developing seasonal affective depression if you have another mood disorder, such as bipolar disorder. I see a pop up. Oh, there we go. So they're linked in families. They're also related to each other. Someone who has one mood disorder is more likely to develop a second one. People with bipolar disorder may be at an increased risk for seasonal affective depression. And what may happen is in those colder months, they may have more frequent depressive episodes or more severe depressive episodes. And in the summer months have more manic episodes. So I want to pause for a second and clarify, because I write manic episodes and I work in mental health and I know what I mean, but just to be clear on what I'm talking about. A manic episode in terms of mental illness is hallmarked by sort of, if you think of it as the opposite of depression, you have, again, that irritability, usually hyperactivity, racing thoughts, people who will go days without sleeping, people who will have grandiose thoughts or like that suddenly inflated sense of self, or even just they'll get fixated on some bold plan. This is the person who in the middle of the night gets the idea to completely renovate the entire house. And by morning, they've ripped the wallpaper off of 4 rooms in the house in a sort of like not really thinking it through. They just impulsively did this. Or they'll get risk-taking behaviors. This is the person who suddenly picks up and goes gambling for a few days and is like, "Ooh, I shouldn't have done that," So a manic episode think of it as the opposite of those depressive symptoms we talked about before. So when we talk about what causes seasonal affective depression, we're really talking about sunlight. We're talking about how changing the amount of sunlight you get affects your circadian rhythm. That's your sleep cycle. That's your awake and asleep times. Your serotonin levels, one of the neurochemicals in your brain that makes you feel joy and happiness and comfort. And your melatonin levels. Now, melatonin, you may have heard of those little gummies you can take to help you sleep. Your brain produces the chemical melatonin to tell you, okay, it's time to rest now. And then the same thing, your melatonin level drops in the morning. It's time to wake up now. People will take supplemental melatonin. They'll take gummies or tablets or things like that as sleep aids. We give them to children even. It's a chemical in your brain that is affected by the sunlight. So when we talk about how that's caused, living in areas like this, where there is a dramatic difference between the length of sunlight we get during a winter day and a summer day is more dramatic. So let me go back out to the next one here. So when we talk about that treatment, we're talking about these 3 forms are the primary: light therapy, medication, or psychotherapy. The first one, the light therapy, it literally is a lamp with a special light bulb that mimics sunlight. Your brain receives this light and feels like you're sitting in the sun. Your brain produces the chemicals it would produce if you were on a beach in Mexico right now. Just fabulous. We can create sunlight now. Just like with anything else, though, this needs to be under the care of a doctor, or at least your doctor needs to be aware of what you're doing, because you can dramatically alter your brain chemistry by overusing a light like this, or using it incorrectly. The way that it's tend to be prescribed is if your doctor tells you you would benefit from having one of these, you buy one of these lights, and there's different ones on the market, different ranges of price, different levels of effectiveness. And in the first hour of your day, your alarm goes off, let's say at 6 a.m. and you need to get up and get ready for work. You're going to sit with this light and expose yourself to this light for a period of time in the first hour of the day to get your brain to really process it's daylight, it's time to be awake, it's time to make the chemicals I normally make when you're awake. Make sense? Yeah. So like I wrote on the bottom there though, overuse of this light or use of this light by someone who already has bipolar disorder can throw their brain chemistry far in the other direction, like a pendulum swing. Yes, you're no longer depressed, but you may have triggered a manic episode. So this is why, again, even something like this that seems innocuous, you're like, I'll just go buy a lamp and I'll feel better. You still want to have your doctor be aware of what you're doing because it could create other issues. But it is a relatively effective way of managing seasonal affective disorder without a whole lot of side effects, right? For the most part, there's not a lot of downside. You're not putting anything else into your body. You don't have to worry about side effects with a lamp. So the second option is medication. Now that would be your standard antidepressants. Now, instead of a person who has regular major depression, who may take an antidepressant every day, constantly throughout the year, your doctor may have you on a seasonal dose. If you know that your seasonal affective disorder symptoms start to pick up every year around October, when it gets gray and gloomy and cold, the doctor may have you start an antidepressant in September. And the reason for that is it takes about a month for most common antidepressants to build up to the effective dose. You can't just start taking the high level. You have to start small and let it build up in your body until you're at the effective, safe dose. And then you would, again, as you get towards the end of the depressive cycle, when your symptoms tend to go away, when it starts to get warm out again, you would come off of the antidepressant or decrease to a lower dose. Some doctors prefer to manage it like that in seasons. Some doctors would maybe put you on a standard antidepressant that you just take year round. It depends on how your body tolerates the medication. Antidepressants also have the risk with a person who has bipolar disorder of swinging them in the other direction. So there are special antidepressants, specific antidepressants to treat bipolar depression. And so again, very important you've talked with your doctor to make sure that you're on the right one. Also in the medication, I didn't write it on the slide, but this is where, again, that melatonin may be helpful for you. Your doctor may say, if you have mild seasonal affective disorder, possibly some melatonin to regulate your sleep cycle may be a good place to start if you're not comfortable moving straight to antidepressants. And option number 3, my favorite, because this is what I do for a living, therapy, right? We talked a little bit about how seasonal affective depression is separate from other forms of depression, but the symptoms are the same. You're managing the same feeling. Maybe yours is caused by it's gray and cloudy outside, and mine is caused by trauma I had last year or something. But the result is we both feel the same level of crappiness. And so therapy can be especially helpful. Therapy also has the added bonus of you're learning skills that you can use in abundance of settings. It doesn't have to just be related to your depression. Skills like building your distress tolerance. I like to point out the one about alternatives to substance use, because many people try to treat their depression with alcohol and drugs. They want to feel better. They think for some reason that alcohol will help with that, but it's actually a depressant. Alcohol is a depressant and usually does not, in the long run, make anything better. So things like therapy can give you extra tools to manage stress, healthy habits. It can help you if you do have other triggers, like maybe you have seasonal affective disorder, but maybe you also have some stuff you need to work through, and going to therapy can help you resolve that as well. So lots of upside to therapy. There's really no downside to therapy, in my opinion, but I'm biased because I'm a therapist. All right. So then going into the last part, this is the last section of it, really. The pro tips. What can you do about it? The first thing is always to talk to your doctor, because they are the experts in this area. But there are some things you can do for yourself if you don't feel it's risen to the level that you need to go to your doctor. Maybe I'm not feeling suicidal, but I am feeling gloomy, and there's something I can do to make things better. The first part is changing your environment. Now, this I will say is a privileged statement to say, take a trip, because obviously not everybody can afford to do that. That's not within everyone's means. But if you have the ability to put yourself somewhere a little sunnier, a little happier, that would be a good time to do that. And if you know that this is something that happens for you every year, planning that ahead is a good place to start. So, anybody do, what do they call it? Snowbirding, where you go like to Florida every year, right? That's used to. That's exactly the idea. You're like, I don't want to be here right now, and I have the means to be somewhere happier. So let's go, right? Even if it's a small thing, like today actually is a sunny day. So going to the beach today, just to walk along the beach in the sunlight, would do wonders for your mood. You can also make changes to your home environment. Having a lighter, happier home, maybe in winter, open those curtains up, open those blinds, get some natural sunlight in. Scoot your breakfast table over in the window. Make some effort to organize your space that it feels lighter, feels happier, and doesn't add to that feeling of depression. I know a lot of people may question the whole, I think it's pronounced feng shui, the whole idea of that the way your house is set up matters, but it's been scientifically proven that it does. The way you organize your home space affects your mood. Getting the dishes cleaned up even affects your mood. Having less clutter, things like that. So there's things you can do to make your home environment feel overall to be a happier space. The second one, scheduling your social and your sleep. One of the hallmarks of depression is isolation. People want to just go take a nap and be left alone, and they don't want to talk to people, and they don't want to come out and be involved with others. So having that planned date, like, okay, every Sunday I'm going to have breakfast with my mother. I'm going to leave my house and I'm going to go do something that involves other people that makes me happy. Planning those events out when you know that this period of the year is going to be difficult for you. Same thing with planning it in the other direction. If you need rest, if being around people is overwhelming for you, planning those activities with gaps, right? Maybe don't plan something every night this week. Give yourself a night off where tonight is going to be a bubble bath and a book, and just giving yourself that space. And the same thing with the routine sleep pattern. Throwing off your sleep affects your depressive symptoms. So even though it's still daylight out in summer, we have to make the kids go to sleep. And even though in winter the sun went down at 5, I'm not going to bed yet because it's not time. I have to make myself stay awake until an appropriate bedtime. Keeping a routine of getting up at the same time every day and going to bed every day will stabilize a lot of the depressive symptoms of seasonal affect disorder. And the last one, exercising for healthy endorphins. Your body is inextricably connected to your mind. So the better you can make your overall health, the better your brain chemistry is going to be. And exercise has been shown to boost those chemicals as well. It doesn't have to be strong exercise, doesn't have to be, going for a 5-mile run. It can be as simple as today I'm going to go for a walk outside, maybe around the block, maybe to the beach. You can also do exercises within your home if it's super snowy and not really within your means to go outside right now, because we don't want anyone slipping on the ice. I've had 3 people today that have called and slipped on the ice. So doing activities in your home, maybe it's just some stretches. Maybe it's just getting your body up and moving and okay, during the commercial breaks of my TV show, I'm going to, do some squats or something. I don't know. Any little movement you can do gets the blood flowing, gets the endorphins moving, gets your brain chemistry in a better place. So there's a wide range of options for how you can address seasonal affective disorder, but I'm going to circle back to the big one. If you are experiencing such low depression that you have even those passive thoughts of not wanting to be alive anymore, not wanting to get out of bed, please see your doctor or come see us at the hospital, because you shouldn't have to feel like that. And there's treatment for it. But you have to treat it like a mental illness, just like everything else. And so we do see during the winter months quite a bit more of this. We will have people come into the hospital for psychiatric stabilization because they are feeling that low. And if that's where you're at, if that's how you feel, please seek the assistance of a doctor, because there are treatments and you should not have to feel that way. So does anyone have questions about the things that Yeah, go ahead. Banana. I know they have potassium. I didn't know they affected your serotonin levels.
Yeah, you make a banana tea.
Okay.
Banana peels and cinnamon. You boil it for about 10 minutes, then strain it and drink tea 25 minutes before bed.
Okay. I'm less versed in the holistic medicine, so I don't know as much about and I can't cook a dang thing.
I just
So,
have to sit on my phone.
oh,
So then lately, I've been eating a banana before bed.
mm-hmm.
I've been having problems sleeping all night.
Okay.
I slept till like 5:30, which is amazing for me.
Nice.
Last night I didn't. I
Hmm.
didn't sleep at all.
No. And it happens. And that's where like there's a range of things. And sometimes that's where the therapy will also start with, okay, what for you is comforting? What triggers at bedtime? I have small children. I have a 7-year-old and a 4-year-old. They're adorable. They never stop moving. Never stop moving. And so we use the melatonin gummies. That's one tool that we use sometimes if they need it to help them regulate their sleep cycle, but also just a routine, right? They come home from school and we have dinner and then we have bath and then we read books and then they go to bed. And by the time it gets to bedtime, their body and their brain are already aware of where we're going with this because it's a routine. And that's where that rhythm comes into play. Whatever suits your needs, whatever it may be for you, it's every night I'm going to have a banana or something. Setting up some kind of rhythm for yourself that reminds your body that it's bedtime, even if the sun's still out, or vice versa. It's not time for bed yet, even though it's dark at 4:30. Because that's one of the beauties of living this far north, of course, is, the closer you live, we live closer to the Arctic Circle than the equator, which means the difference of sunlight between our winter days and our summer days is very dramatic, right? We lose several hours of sunlight in the winter. And so people who live closer to the equator experience less seasonal affective depression because their days are more stabilized from season to season. And so there are even some people who make the choice. I have a friend from college. We went to Grand Valley together that she suffers from this illness. And the resolution for her, she didn't want to be on an antidepressant full time. She moved to North Carolina. She lives in Wilmington and she has a more stable summer day, winter day balance and experiences far lower rates of depression. You look like you were going to say something.
I was going to ask,
Yeah.
when you say see a doctor, do
Mhm.
you start with your GP or do you try and find a therapist?
That's a good question. I would say you can start with either. Your general practitioner should be aware of this condition, and any trained medical professional is going to recognize the hallmark signs of depression. They may then ask you questions. They're going to do a health evaluation because in our field, the way it works is you have to rule out medical conditions first. So if you start with your general practitioner, they may run a blood panel, check and make sure your thyroid is functioning right, because those things can trigger depressive symptoms as well. They're going to rule out the medical things first. They also may ask you questions about, like, again, triggers, trauma, history, stressors, to see if this may be standard depression that is related to an incident. And then you'd be recommended to go to a therapist or a counselor or psychiatrist. And if the doctor you're seeing feels comfortable prescribing an antidepressant, they may choose to do so. Not all general practitioners, not all doctors will prescribe psychiatric medications. In fact, we often see that, for example, your nurse practitioner at the clinic or something, they may only be aware of 1 or 2 types of antidepressants. Prozac's pretty common, right? They've done movies about it. That one's one people have heard of. And the doctor may feel more comfortable prescribing that particular medication. But if that's not the right medication for you, it may be beneficial to see a specialist like a psychiatrist. They could refer you, or you could usually just call. Yeah. For those of you who are local, and I believe everyone zooming in may be local here, there are community resources just that I would recommend starting with. Alcona Health Center does have psychiatrists. They have their own behavioral health program. They also have their own therapists and counselors. So if you're already a patient at Alcona Health, they would be able to help you with those services as well. If you're someone who has Medicaid or no insurance, you can also utilize services at Community Mental Health, which happens to be next door. It's between here and the hospital. It's the building next door. They service anyone in the community who has Medicaid or no insurance. If you have a form of insurance, you can also check. We have an outpatient behavioral health program at the hospital. So we have providers, prescribers, therapists at the outpatient behavioral health desk as well. And there are more in town. There's the Waters Clinic, there's Caris Counseling. There are several mental health resources you could start with. Really what it comes down to, and I would say let's see if this will let me click back over here. Where do you want to start? If you're someone who feels comfortable with, I think an antidepressant would be the way to go for me, let's start there. Maybe your doctor would be a good place to start. If you're not comfortable going straight to a medication supplement, therapist could be a great place to start. Or even, talking with your doctor about what kind of light box you could try, because that's a pretty low impact. Let's start with the light bulb and see if that helps. You don't have to make time for a weekly appointment or anything. You don't have to deal with possible side effects of a medication. Starting with the light therapy may be the way to go. So you have to look for yourself and say, which option do I want to start with? You may also need more than one of these. The light box may help a little, but you may still be benefited by therapy or medication. And so combining till you hit the right level for you would be the way to go. I will say, just because I hate this part of it, but it's a true statement. Your insurance may have rules about going to a psychiatrist without a referral. We live in the age of insurance lobbies ruling the world. So you may need to start with your primary care. And if they say, I'm not well versed in this disorder, or I would like to have you evaluated by a psychologist or psychiatrist, then they'll give you that referral you need. So it may be worth contacting them first just for that element of it. Your insurance or your provider or your doctor, to see if in your case with your specific insurance plan, do you need a referral for behavioral health services? There's also a resource I think a lot of community members don't know about. Has anyone ever heard of 211? Not so much. Okay. So when you call for emergency services, 911, right? You're going to get ambulance, fire truck, police, that kind of thing. When you call, I think 811 is the one that they dig in the ground for the wires if you're doing construction in front of your house, something like that. 311 is city services. The water main downtown broke and you need to tell somebody about it. You're going to get the city itself by calling 311. Well, 211 is social service support. It's run usually through the United Way. I used to work for the United Way of Central Maryland when I was in Baltimore through their 211 office. And it's a 24/7 call center with resources. You call them and they will connect you with resources in an abundance of social service areas, mental health support being one of them, or substance use treatment, or housing, or food support, maybe paying utility bills, financial assistance, faith-based services. They have a ton of resources in their database that they then talk with you about what you might be eligible for and get you connected. My old job at the 211 in Maryland was to help connect people to food bank assistance, people who needed groceries in an emergency situation. I did that for a while. And then when the pandemic started, the CDC funneled calls through the 211 call center so that if a community member had questions about testing or symptoms or what to do, or simply anxiety about the pandemic, they would call us as well. Yes, it exists in every state. If you call 211 from your local phone, I would say definitely from your house phone. I'll have to check. They have a full phone number as well, like a 989 area code phone number as well. I'll have to remember what it is. But if you call 211, it'll ping off the nearest cell tower and get you to the nearest community 211 call center. Ours happens to be downtown Alpena. Yeah, it's a resource a lot of people don't know exists. And now you do still have to do some legwork. You call and you say, hi, I need assistance with, getting connected to a mental health professional. They may give you 12 more phone numbers to call, but it's a place to start. And for people who don't have any idea what resources exist, it's a great place to start. The same thing goes for any other social service support you may be looking for. So I think the big takeaway for this, obviously, is that don't brush off that feeling. Your feelings are valid and they're there for a reason. So if you're experiencing these symptoms, don't just be like, oh, it's the winter blues. I'll feel better in April. It'll be fine. That you can power through it like that. That is positive thinking, but you don't have to feel like that all winter long, especially living up here where it's an awful long winter, right? It snowed at my high school graduation in June. Like we can't just wait for the sunlight. Sunlight takes a minute up here, but there are resources and there are available options, but please do so with the assistance of your medical providers, just because when we try to treat ourselves, that tends to end poorly a lot of the time. Does anyone have any other questions or comments on this or other topics? It's fine if you have other topics as well. No? Well, thank you for letting me come speak with you. Appreciate it.